unions across the UK who are fighting to defend the NHS, and I'm also representing the Medical Practitioners Union, which is the doctors' branch of Unite the Union. And because we recognise the value and importance of everyone who works for the NHS, directly or indirectly, like you, we know that all such staff, whether in the private or public sector, who contribute to the provision of care for patients, need decent pay and conditions in order to carry out their job to the best of their ability. This benefits everyone who depends on these services. I'm a GP. As healthcare practitioners, we depend on samples and materials and blood products being transported quickly and efficiently. And this work is both vital and risky. I've heard about the risks to your health and the number of accidents. The thought that your union, that you don't actually have the right to sick pay is actually absolutely appalling. And I think the media has misrepresented that and made out that you've got that. You haven't. I know your union has been amazing in fighting for better rights for you as workers and has achieved a lot, but there's still a long way to go. Decent pay is the bedrock of a healthy society. Britain is one of the most unequal societies in Western Europe, and this is directly linked to health inequalities and the poor health of people on the lowest income. So there's a wider health issue here about people having decent pay. If we want to have a better, healthier, happier, thriving society, we need to reduce income inequality. And that means bringing up the incomes of the lower paid. So it is right and proper for doctors and other health professionals to support the struggles of lower paid workers for decent pay. And in the long run, it will make society, our whole society, healthier. Trade unions are really important. Without them, no worker, private or public sector, including NHS staff, would have the pay, conditions and rights that most of us enjoy today. Your union has been amazing. Using a combination of campaigning, industrial action, legal challenges, you've managed to win important rights. But there's still a long way to go. 3 years ago, the junior doctors took unprecedented strike action, the first junior doctor strike in 40 years, over plans to change their contract so their pay and conditions would worsen. It's a bit like you've been subjected to pay cuts over the years. The junior doctors showed great strength and determination and had massive public support, but they did not win outright. The new junior doctor contract was imposed without agreement, and they're still officially in dispute. But they did win some important changes, including better monitoring and accountability and unsafe working conditions, and the right to review of how the contract is working. The junior doctors are currently in negotiations to get improvements to the contract, and will put the result of their negotiations to a ballot of junior doctors this summer. So their struggle is not over. Watch this space. The point is that the junior doctors would not have achieved any of this, even their partial successes and their hope for further improvements, if they had not taken action. You don't win everything, but by taking action, you have a greater chance of a better deal than if you did nothing. When I look at the history of your union and the workers in TDL coming together to join the union, the IWGP, I see an impressive history of struggle and of very significant achievements. Now you're on strike. I'm sure you don't want to have to do this, but the intransigence of your management has forced you into this situation. It's hard because you will be accused of harming people. But who is responsible for any harm done? Those who decide to go on strike as a last resort, or the employers who give you no choice? Remember, those employers could easily give you what you asked for. They're making obscene amounts of money from exploiting their workforce. No one wants to go on strike. But without that last resort, or at least the threat of that last resort, there's sometimes no way to force employers to be reasonable. What you're asking for is not unreasonable. Workers have the right to collectively organise to demand better pay and conditions. You're not asking for anything excessive, just decent pay and conditions. Don't let them use emotional blackmail on you to stop you doing what you need to do. In the long term, ensuring good paying conditions benefits the service you provide. because properly valued and rewarded workers provide a better service, and improvements to any workers' rights and pay encourages others to fight for the same, and so it helps to lift everybody up. So instead of divide and rule, it should be you win, everyone wins. And as I said before, unless the scourge of low pay is tackled, there's no hope of reducing inequalities in our society. Couriers and doctors should be united in this fight. Because we're part of one big network. We're all interdependent. Employers and government try to divide worker against worker, but the truth is that what we have in common is that without organising in unions, without campaigning, without enforcing our rights, that we would all be much worse off. So we must all support one another. A victory for one is a victory for all. And when you do win, as I said, it will be a victory for everyone, because it will be an inspiration to all that even the most marginalised workers can win if they are organised and determined. And that will be just one small but important step in building the kind of society most of us aspire to. A fairer, healthier, more equal society where all can thrive. Solidarity!